Welcome to the training on occupational health, environment and safety. Let us learn the module on first aid for snake bites. Before we begin, let's take a look at the key learning objectives. After completing this module, you will be able to explain snake bites and identify poisonous and non-poisonous snakes, recognize and list symptoms of snake bites, demonstrate the first aid for snake bites, list precautions to avoid snake bites. Snake bite, an overview. 421,000 snake bites occur worldwide each year. 46,000 people die due to snake bite in India itself. People who live near wilderness or trekkers are at greater risk. Most snakes are harmless. However, even a bite from a harmless snake can cause pain and have an allergic reaction and needs treatment. Let us see the difference between venomous and non-venomous snakes. You can identify a venomous snake from a harmless snake by the shape of its head. Diamond shape is usually poisonous. A head the same width of the body or neck is usually non-poisonous, as shown in the image. A snake bite can affect many parts of the body, and you can see in the image the major symptoms of snake bite, which affects the central nervous system, vision, the heart, the respiratory system, the muscular system, the stomach, the intestine, skin. If a snake bites you, first aid to be taken is: Step 1. Remain calm, immobilize the bitten arm or leg, and stay as quiet as possible to keep the poison from spreading through your body. Step 2. Remove jewelry before you start to swell. Position yourself, if possible, so that the bite is at or below the level of your heart. Step 3. Cleanse the wound, but don't flush it with water, and cover it with a clean, dry dressing. Treat the wound with an antiseptic ointment. Apply a thin coating of antibiotic ointment to the clean wound. Bandage the wound. This will protect it and help to prevent infection. Pay attention to the wound as it heals for any signs of infection, such as redness or streaking. Get medical attention. Call your local emergency number if someone has been bitten by a snake. If possible, call ahead to the emergency room so that the antivenom can be ready when the person arrives. Let us also know what we should not do if a snake bites. Do not apply a tourniquet. Do not apply cold compresses to a snake bite. Do not cut into a snake bite with a knife or razor. Do not try to suck out the venom by the mouth. Do not give the person stimulants or pain medications unless a doctor tells you to do so. Do not give the person anything by mouth. Do not raise the site of the bite above the level of the person's heart.
In the case of snake bite, make sure the scene is clear and that no snakes are near before treating the patient. Calm the patient if they are anxious. Not all snake bites inject venom into the victim, even if the bite is from a venomous snake. Some bites are considered dry. Treat an extremity snake bite similar to a fracture. Immobilize the limb with a splint or sling to prevent movement or muscular contraction. This will reduce the absorption of the venom into the bloodstream. At the same time, keep the patient as still as possible in order to slow the progression of the venom through the body and tissues. If possible, identify the snake so that the proper antivenom can be administered. In snake bites, the most important treatment is transportation to a hospital stocked with antivenom therapy. Avoid interfering with the bite wound because this could introduce infection, cause bleeding, or increase the rate at which the body absorbs the potentially fatal venom. Although many home, herbal and folk remedies exist, international standards recommend against using them. Do not try to suck the venom out with your mouth. Do not cut around the bite with a knife. Do not place herbs on the bite. Do not apply a tourniquet.
Let us see how we can prevent snake bites. Avoid going close to or touching any snake. Most snakes avoid people if possible and bite only when threatened or surprised. Do not attempt to kill a snake. While hiking or in the woods, stay out of tall grass. Do not put your hand into pits or crevices during treks or lifting rocks or any object in the wild. Be careful while climbing rocks. Use a torch in the dark.
How to avoid a snake bite. Here's what you need to know to keep snakes at bay. You will need boots, pants, a tent with a working zipper, and, caution, optional, a walking stick. Step 1. Make noise while you're walking in the woods. Step heavily to make the ground vibrate and scare snakes away. Step 2. Wear long pants and tall boots when you're hiking or camping. They will protect your feet and legs from snakes as well as insects. Step 3. Stay on the trail when hiking. Don't wander off into the brush or tall grass where snakes may lie hidden. If you can't avoid tall grasses or brush, use a walking stick as a feeler for the ground in front of you. Step 4. Pitch your tent in a clearing away from potential nesting sites, including tall grass, logs, boulders, and brush. Keep your tent zipped tight at all times. Step 5. Don't reach into dark places where snakes might be sleeping or hiding, including rock crevices and hollow logs. Be careful when moving rocks or gathering firewood. Remember that not all snakes stay on the ground. Some slither up trees and hang from low branches. Step 6. Don't touch a snake if you come across one, dead or alive. If it doesn't slither away, go around it. Some dead snakes still have a bite reflex, so don't mess around. Step 7. Don't panic if you are bitten. Wash the wound and get to a doctor immediately if you suspect the snake might be poisonous. Did you know? The Gaboon viper, an African snake, has fangs that grow up to 2 inches, longer than any other snake.